Hi, I'm David Greene, CEO of the Florida Pain Network, where we connect those in pain with the best pain relievers throughout the state, including Florida pain clinics, chiropractors, and physical therapy practices. The topic today is failed back surgery. Why does it occur and what can be done about it? Well, the twist on the subject that I want to talk about is if you had a back surgery that was initially successful and then failed, what went wrong? There are three main things that can go wrong after a successful back surgery. Number one, the hardware breaks or it gets loose. Surgeons will put in hardware in the levels that they're going to fuse. Let's say it's an L4-L5 surgery. Here's L4, here's L5. You want them to weld together. You want the bone to expand the area so that there's no more movement. In order to do that, they often put hardware in, screws and rods, to keep the levels from moving until the biology fuses and it welds together bone to bone. What if that doesn't happen? If it's only the hardware that keeps holding the two levels together, but you don't get that welding together, that's a problem. Eventually the hardware will give away and it will start to loosen and then maybe break. And then a patient's pain may be going from just fine, baseline, way up. Okay? So that's what can happen with a hardware failure. If you had a successful back surgery and your pain went shooting up, it may be that the hardware failed. Second reason, number two, is called adjacent segment degeneration. Let's go back to the same example. L4, L5, fusion took just fine. Okay? No more movement at that level. So that level can't absorb any of the stresses of daily life. When you bend or twist or any of that, those stresses have to go up or they go down. If they go down to the L5-S1 level, you can see what's called adjacent segment degeneration, and it gets accelerated. So what normally was mild to moderate degeneration can go up, and you can start to get big time pain from that. Okay? And it can happen in any type of spine surgery that you have where you fuse a level. What to do about that? Thankfully, most of the time it can be treated non-operatively, and a person can get away without needing another spine surgery, either through medication management, interventional procedures such as radiofrequency ablation, epidural injections, facet blocks, physical therapy, chiropractic treatment. So the third reason that people will get pain after a successful back surgery is scar tissue. You have a successful back surgery, the back pain goes away, the leg pain goes away. 6-12 months later, you wake up, you start every day having more pain again. Same leg, same situation, more pain in the back. What is it? Why does scar tissue do that? Well, what happens is during the initial surgery, anytime you take out tissue around a nerve root, around the spine, it may work really well right away, but something fills the space where that surgery was done. And the body puts scar tissue there. You don't want it, you don't need it, but it's going to happen. So we don't have the magic dust substance powder that right now that will prevent scar tissue from coming in. There's some that are coming into play, but what can happen is you have a nerve root that had this to begin with. It was getting pinched, okay? And you took the tissue away, the surgeon took the tissue away that was pinching the nerve, and now it's fine. But what if more scar tissue envelops the nerve and it starts to pinch it again? Well, it may be a situation where going back in and taking out the new scar tissue is going to just bring more scar tissue back again. So you get a wicked cycle of no scar, more scar, no scar, more scar. And you risk injury to the nerve root every time the surgeon goes back in. So it may be what's called lumbar laminectomy syndrome, where scar tissue forms around. What do you do about that? Well, non-operatively, there are some options. There are some medications that can help with that type of bad nerve type pain, some pain medications, some types of therapy can help. One of the last resort treatments that can work really, really well is a spinal cord stimulator. And these treatments are minimally invasive, low risk, and high yield. Some studies have shown 80-some% effectiveness, and then over the years it goes down to 60-some%. But if you have no other option, if surgery is not an option, if you're taking too much narcotics for what you want, that can be really helpful. So Florida pain clinics in our network who do spinal cord stimulators, that do medication management, that also do these other types of treatments such as chiropractic, physical therapy. Check us out at floridapainnetwork.com. Just click on I need a pain doctor, I need a chiropractor, I need a physical therapist, and the ones closest to you will show up first. I'm David Greene, CEO of the Florida Pain Network. Your pain stops here.